Hey everybody, welcome back to the channel. This is Jeremy again from Mental Health Matters. I wanted to touch base real quick and give you guys some ideas for managing your mental health during this COVID-19 coronavirus emergency that we have going on. So I have 5 tips for you to try to keep yourself sane and healthy. Alright, number 1, keep your body moving. You've got to keep moving. You've got to exercise. You've got to try to stay healthy. If you can, try to get outdoors as much as possible. Get that good vitamin D from the sunshine if you can. Certainly wear sunscreen. Get out into the woods. We know that being in nature is very beneficial. But whatever you can do, just do what you can. Get out and move your body. Okay, number 2, get some alone time. This one is for my people who are living with family members, living with kids, having to take care of people, having to do the homeschooling. You have got to get some time to yourself to try to take care of yourselves and to get some quiet time just to decompress and take care of yourself. Number 3, have some structure. You've got to have a routine so that you can keep yourself feeling like you're being productive and you're getting things done. Try to make it something that's easy to accomplish. Something like creating a list, getting outside, doing some gardening, making sure you get some things done around the house, getting that work done that you have to get done if you're working from home. But try to make sure you're getting up at the same time every day if you can. Try to make sure you're having a routine. This is especially important if your routine has been greatly disrupted by either being laid off or being someone who's now in a completely different situation, as most of us certainly are. Number 4, make time for other people. Make sure that you stay connected. So this does sound a little bit counter to number 2 of needing alone time, but we all need to stay connected. So we need to try to stay connected to those people that maybe we have lost touch with because we're not working any longer, or maybe some friends and family that we can't see because we're quarantined. So, we need to try to be creative right now using FaceTime, Zoom, phone calls, whatever we need to do to stay in touch with friends and family members. Those folks are very important in order to keep us sane and to help keep us healthy. Number 5, get some sleep. It's incredibly important that we get 7 to 9 hours of sleep every night, if at all possible. But whatever you can do, get as many hours of sleep, approaching that 7 to 9 hours as you can. Research has shown time and time again that when we don't get enough sleep, it greatly impacts our mental health as well as our physical health. We're more likely to get sick, we're more likely to experience chronic health problems, and we're certainly more likely to experience mental health related conditions if we do not get enough sleep. And lastly, a bonus tip. If none of these things are working, or you're doing all of these things and you're staying healthy, trying to stay healthy and on top of these things, but you still feel like you're overwhelmed and you can't handle the stress of either the pandemic or just in general all of the changes that have been going on in life, reach out to a therapist. Find somebody. Online therapy is booming right now. There are a ton of providers, great providers, that are providing online therapy. We have more access to great mental health clinicians than we ever have with this pandemic going on right now. So I encourage you to reach out and find somebody that you feel like you can connect with, and somebody that will be there for you and help you through a difficult time. Therapy is something that sometimes there is a little bit of trial and error. You may have to try a couple of different therapists before you find one. It's not at all unusual to try a couple of therapists and find that they just weren't a good fit. We know that the thing that is the most effective for therapy is the relationship. While having all of the skills necessary to be a good therapist are certainly vital, none of those things mean much of anything unless you are able to create a relationship with your patients or your clients. So I encourage you to reach out and find somebody that you feel you have a good connection with. And after about 2 to 4 sessions, you should have a good idea if it's working for you. And if it's not, don't be afraid to say something. Maybe there's something that can be done to change it. If nothing can be done, then certainly find someone else. Alright everybody, thanks for watching. I hope you found these tips helpful for you. If this is your first time visiting the channel, please don't hesitate to click the like button and subscribe, and go ahead and share this with friends and family and other people that you think might benefit from it. In the future, I plan to have a lot of content related to mental health issues and related to therapy and treatment and those sorts of things, addiction and other mental health related conditions. I plan to interview some friends and colleagues and other experts in the field, so I hope we can have a dialogue and a conversation about mental health, and I hope you'll come with me and join me in this. Certainly my editing skills and my video skills will get better as time goes on, so I appreciate you forgiving me of not being terribly great with those at the moment, but that will hopefully improve as time goes on. Again, thank you for your time, and I hope you found this helpful. Take care.